Welcome to the M.I.C.U. Medical Infection Control United. We are committed to preparing every healthcare institution to become and remain accredited. Please observe the entire video. You will receive a portion of what we do and how we achieve excellence worldwide for the medical communities.
First, let's take a look at bloodborne pathogens. Bloodborne pathogens are infectious microorganisms present in blood that can cause disease in humans. The pathogens include, but are not limited to, the hepatitis B virus, HBV, hepatitis C virus, HCV, and human immunodeficiency virus, HIV, the virus that causes AIDS. Workers exposed to bloodborne pathogens are at risk for serious or life-threatening illnesses.
In general, the standard requires employers to a. Establish an exposure control plan. This is a written plan to eliminate or minimize occupational exposures. The employer must prepare an exposure determination that contains a list of job classifications in which all workers have occupational exposure and a list of job classifications in which some workers have occupational exposure, along with a list of the tasks and procedures performed by those workers that result in their exposure.
B. Employers must update the plan annually to reflect changes in task, procedures, and positions that affect occupational exposure, and also technological changes that eliminate or reduce occupational exposure. In addition, employers must annually document in the plan that they have considered and begun using appropriate, commercially available effective safer medical devices designed to eliminate or minimize occupational exposure. Employers must also document that they have solicited input from frontline workers in identifying, evaluating, and selecting effective engineering and work practice controls.
C. Implement the use of universal precautions. Treating all human blood and OPIM. Other potentially infectious materials if known to be infectious for bloodborne pathogens. D. Identify and use engineering controls. These are devices that isolate or remove the bloodborne pathogens hazard from the workplace. They include sharps disposal containers, self-sheeting needles, and safer medical devices, such as sharps with engineered sharps injury protection and needleless systems.
E. Identify and ensure the use of work practice controls. These are practices that reduce the possibility of exposure by changing the way a task is performed, such as appropriate practices for handling and disposing of contaminated sharps, handling specimens, handling laundry and cleaning contaminated surfaces and items.
F. Provide personal protective equipment. PPE. Such as gloves, gowns, eye protection, and masks. Employers must clean, repair, and replace this equipment as needed. Provision, maintenance, repair and replacement are at no cost to the worker. G. Make available hepatitis B vaccinations to all workers with occupational exposure. This vaccination must be offered after the worker has received the required bloodborne pathogens training and within 10 days of initial assignment to a job with occupational exposure.
H. Make available post-exposure evaluation and follow-up to any occupationally exposed worker who experiences an exposure incident. An exposure incident is a specific eye, mouth, other mucous membrane, non-intact skin, or parenteral contact with blood or OPIM. This evaluation and follow-up must be at no cost to the worker, and includes documenting the route of exposure and the circumstances under which the exposure incident occurred, identifying and testing the source individual for HBV and HIV infectivity, if the source individual consents or the law does not require consent, collecting and testing the exposed worker's blood, if the worker consents, offering post-exposure prophylaxis, offering counseling, and evaluating reported illnesses. The healthcare professional will provide a limited written opinion to the employer and all diagnoses must remain confidential.